Okay, so welcome everybody to June. I don't know how we're in June already, but here we are. So we got a few things to go through tonight. So thanks for everybody for coming, and make sure to clock in if you haven't yet. I'm sure you've all seen that I've been back in training again. Seems like around this time we have to add some more people. Kidding. And I just want to welcome our 3 newest RVTs. Andre, Justine, and Steph V. Steph hasn't had she's been onboarded but hasn't been on training yet. But she will be when she gets through things. I don't know if everybody's here or not. I can't quite see everybody's avatars, but feel free to come on mic and say hello if you'd like, or you can just wave or type in the chat, anything like that. But yeah, we've got some new faces for sure. Speaking of new faces, Mike, did you want to take this slide, or do you want me to just introduce Jared? Or have Jared introduce himself?
I'll do a quick little intro, and then Jared, you can jump in and intro the rest of yourself. So Jared is joining our team as our director of product. It's been a long time coming since there's been anybody to help me out on the platform side of things. On the tech, it's been slow lately, and that's just been a product of we're busy with a lot of other things, so it's hard to focus on the platform. So Jared's going to be joining our team. He comes from a very rich background of change management and managing development workflows and things like that. So I'll let him introduce the rest of that. But hopefully, as a result of that, and as continuing to build on the technical side, you guys will see ongoing enhancements to the platform, streamlining your work. I think it's at the end of the day, it's the best. The outcome is going to be best for you guys as a team. That's ultimately going to be the impact. And so to that end, we've always requested feedback on the platform and things that we can do better. But as we have this new support, I mean, it's an opportunity for us to look at the platform again and say, if we can change things, if you guys could change things, what would you change? What new features would make your workflow easier? We can start to really kind of focus in on those and start to build those out with Jared. So Jared, if you want to take it from there, anything else you want to add?
Yeah, thanks, Mike, and thanks everyone for having me. It's exciting to be here. Yeah, not too much to add. I guess a little bit about me. I have a cat, as alluded to in the picture there. I was living in New Zealand for about the last 2 years, and I've just moved back, so living in the Hamilton area. My background, as Mike mentioned, is change management, which is really vague and broad. But yeah, prior to that, I've been working for banking, IT, and different things like that, telcos. But yeah, really excited to be here helping with some of the platform stuff. You'll see me in Spot most of the time. Yeah, happy to chat for anything. Just send me a direct message or give me a nudge or whatever in Spot as well. Also available on Slack. But yeah, I'll be coming up soon with formal ways of submitting suggestions for platform improvement stuff or changes or bugs. They can also come through Sarah, or you can shoot me an email, whatever you're most comfortable with. But yeah, it's all happening.
Yes, we're very excited to have Jared. Mike needed help, and it's nice that Jared's been pretty much jumping right in, and I've already bothered him a few times with a few things, and he hasn't run away yet, so that's a good sign. So, schedule.
So
What was that?
you balance the bother with help, so it's fine.
Okay, good. All right. Um, I don't know what that was. Okay, so schedule. I always talk about the schedule, but we have some new updates, some changes you guys might have seen if you've been on shift this week at all. As we keep growing and responsibilities change and volume changes and these kinds of things, we do have to kind of be fluid with who does what and when and that kind of thing. So this week, we have moved around a few of our full-time RVTs to different shifts to kind of better support increasing call volume, as well as, like I said, those additional responsibilities. So I have moved from 1 p.m. to 9 p.m. to 9 p.m. to 9 a.m. Well, I wrote 9 p.m. to 5 p.m. You can tell that I rushed through these slides. 9 a.m. to 5 p.m. To support the daytime volume, so Amanda can focus on managing our hospital accounts, and Steph will now be moving from 5 p.m. to 1 a.m. to 1 p.m. to 9 p.m. To fill in the gap. So you may still see me in evenings if I need to train a new hire, of course. I will accommodate them as much as I can. But I am kind of passing the torch of the evening shift on to Steph, and she she has graciously accepted it, and so I hope that things continue to go well. Um, and yeah, that's where we're at with that. But to that end, because of the reconfiguring of the schedule, we are looking for RVTs and interested in recurring shifts for July. There are some open shifts right now for June because we kind of did this little mash. Maybe I shouldn't be leading the meeting today. Mad dash scramble to kind of get Amanda coverage. So the shifts are going to be that I'm still looking for people that would like recurring are 12 a.m. to 3 a.m. Monday to Fridays, as well as Tuesdays 9 p.m. to 12 a.m. If you're interested in those for July, just send me an email to the schedules would be the best one. And then please continue to send your time off and unavailability through Sling, especially with the holidays coming up and everything and it being summer. July schedule will get started this week and should hopefully be out next week. Just trying to put things together with last minute recurring shifts. This one's Amy. If Amy's in here still.
Hi guys, I'm here. Just wanted to update you guys on a few changes and hellos and goodbyes. As most of you know, we said goodbye to Dr. Collins at the end of June. She's returned to in-person practice local to her home in Newfoundland. So she will be continuing with our network at this point. And so you'll still see her from time to time, but she's left her full-time overnights position. Joining the team on nights will be Dr. Jessica Bronsoiler, Dr. Victor Palo, who will be taking on more shifts, and then that will be going into that rotation as well. So you'll see a little bit of a change in the scheduling for overnights, and that it'll be not Monday to Friday and the weekends, but a little bit more rotational, just for fairness. As well, Dr. Kathy has had to reduce her hours a little bit in June due to medical reasons, and so she'll be back hopefully up to her regular hours in July. Just wanted everyone to be aware of that. And we're continuing to onboard for the network and prepare for summer. um, Dr. Kash Karupu will be joining us on a regular basis. She's working on her dual licensing, and so her first shift will be this Sunday. So if you're working on Sunday, just if you could help Kash along, that would be great. And I think that is all of the updates as far as I'm concerned. As always, if you have any questions, don't hesitate to reach out to me directly. You guys all know how to grab me.
Amy, I don't know if you wanted to take this one. I can. It doesn't matter. It came through the DVMs, I know.
Yes, I would. In our recent DVM meeting, we had some fabulous feedback from our DVMs on how thrilled they are to have our lead RVTs, Lindsay, Cheryl, and Shauna. They've all been working really hard to keep our shifts running smoothly. And we're super grateful to them for all of the work and to all of you for being receptive and working together as a team. So thank you, and the vets thank you.
Speaking of Lindsay, you're
I
up.
guess I guess it's my turn. We had the most votes so far. I feel like people are really getting into hospital of the month, which makes me happy. We had 16 votes this month. Some really great ones that I want to mention. Walden Animal Hospital got a vote for offering to do all post-op care for a non-client PIO surgery if another clinic could do the surgery, and they weren't even on call, which is amazing. Martindale for always just taking transfers even when they're slammed and always helping out with non-clients. Springer Animal Hospital took a porcupine quill at 2 a.m., even though they had an insanely busy day. Again, non-client. And I'm just trying to look through here. There's so many good ones. We had a clinic, Perry Sound Animal Hospital, that filled a script 10 minutes before close on a long weekend for a non-client. And there was Armstrong Vet Clinic there that did a payment plan for euthanasia that really, really did need to happen. And an honorable mention for a nursing station that actually came in after they were closed to help fill a script for a dog with a broken leg. that couldn't fly out for the next couple days to get veterinary care. So amazing, amazing, amazing. The winner this month is actually a repeat winner. Parkside got 4 votes this month, so they rocked it. And that's it for me.
Good for them. Parkside's awesome. They're always fantastic to deal with, and they go over and above anytime they can anyway, so that's great. I just wanted to do a quick reminder of the custom triage criteria. Thanking Mike and Jared for pushing an update now that the criteria, the custom ones, are actually at the top now. I put in the screenshot here. So they should be easier to see. You do have this big long line, kind of a little bit thicker here, that separates the two. The point of the custom criteria is to give our hospitals, mostly, I think it's mostly the ones that are on call, that have on call, additional options of things that they may want to see in person or may want to be an option to be seen in person right away. Whereas an ER, may not want to see a post-op 48 hours, like a little spay incision infection. But, our on-call clinics may want to see their regular clients or clients of the group. So just make sure that you're always familiarizing yourself with what is been chosen for each clinic. And again, now that it's up at the top, I think it'll be a lot easier to see for sure. So thanks again for that update, guys. Amy, you're up again.
I thought we said I wasn't chatting in this meeting. Just a quick
You're
keeping
holding Sharon, sorry.
just a quick housekeeping reminder on medical records and best practices. And so we just want to make sure that we're keeping the information pertinent to the pet within the main concern and not putting any outside information into that main concern regarding the client, etc. This section is visible to the clients, so we should be really careful what's documented in that main section. And then the private note section should be utilized for anything that we wouldn't necessarily want the client to see, but keeping in mind that they could have access to that at any given time if they requested their medical records through their veterinary practice. And so, quite a number of years ago, for you old timers like me, we remember when the privacy policy came into place in Ontario pertaining to the types of things that are written into medical records. And I just want to review a few of those things when we're writing our records. And so this can be anything from presenting complaint right through to medical records, and it applies to us as support staff and to our DVMs as well. And so we cannot place any opinion based statements into a medical record. So everything that is written into a medical record has to be factual. Therefore, you couldn't say, I suspect the client is drunk. You could say, the client had slurred speech, or the client was difficult to understand. So you have to be very, very careful. And if there's an issue with a client, you have to be factual. And so you can record the statements that the client has said to you, but you cannot infer any perceptions or judgments on that interaction with the client. And so, the client declined transfer and may have said many explicits to you along the way, but basically it was a financial concern. We want to write that the client declined transfer due to finances, and so limiting all of the extras. I think that is probably a really good assessment. Does anybody have any questions or any comments on medical records and their own experiences?
So I do have a question. Is it possible for us to put an area somewhere where we can put more information where the clients won't see it? So like
No.
yesterday I had a client, I gave her all the options that I could, and then she declined all of them. So I said, well, we can do a virtual for a dog bite. So I offered that virtual consult so we can at least get the pet some payments and antibiotics. And so we can send it to a human pharmacy. She said, you don't understand. Everything here is closed. And then she's like, now you're just making me mad, and hung up on me. And I'm like, okay. So the next person, so I documented that because that is what she said.
Mhm.
so then the next person, they got that call, like I closed the call, I didn't put an MCB. But the next person who gets that call, shouldn't they be aware, like, what was offered and what the client was like?
So not what the client was like, because that's your perception.
Well,
What
no, I
was
wrote down what she said to me. I didn't say she was rude. I just said, like, I said this, the client said this, and then she hung up.
right.
So
And
is
and
that
that's
okay?
and that's fine. It
Okay.
has to be factual. And it can't have any perception. And perception, it can be very different
Okay.
from person to person. So I presented the client with these three options: one, two, three. The client felt that none of these options would be suitable in her area, declined, and discontinued the call.
Okay.
Okay,
Um,
you
can I get maybe a point of clarity, Amy? I just want to ask,
yes,
and maybe this is helpful for everybody, but also helpful for me. These notes or these comments that you're making on factuality in our notes, these apply to calls as well as consultations, correct?
that's correct.
Okay. So, and I just want to make the point that in a call, the owner is not going to see your call notes. So call notes are never visible to the owner. It's private notes in a consultation that would become visible to the owner.
Okay.
Potentially, it's not, and it's not like we give them to the owner anywhere. It's that right we send the medical record with private notes. But keep in mind, call notes are not the same. Call notes end up being in the hospital portal, but most hospitals won't export that and put that into their PIMS. If that makes sense.
Okay. Good to
And just a reminder that in practice the rules are actually the same, and so that our medical records in practice should remain the same. We can certainly let record in a record that a client was not satisfied with our options or solutions, and that they discontinued a call, or that they felt frustrated, or that they weren't happy in professional terms. But we do have to be very, very careful about the terms that we use. A client could request those records, and then a client could charge us with slander. Or if a client was slurring their words and we accuse them of being drunk, and that client had a medical issue, we could be in big trouble as well. And so the privacy policy, I can actually, maybe I'll look it up and have Sarah attach it to the minutes for the meeting so that it can be reviewed. But it's a standard in Canada, and so I'll be sure to get that information so that you guys can all review it.
I think it'd be really good to have that. I think the biggest part, and we keep mentioning like the make callback section, is that when we're not actually working in person with each other, to have everything documented just for notes, because, when the calls are coming in, we can't always update everyone in spot on every single person we've talked to, or note like things that have come up and stuff too. So I think everyone's trying to document their notes well, just so if the next person takes that call, it's easy to follow through without trying to track that person down. But just that reminder to cut and paste out those notes and then put them into the private notes or somewhere. I think the biggest thing is if there was something said or declined, and we don't have it documented somewhere, where does that fall? Do you know what I mean? So a lot of those notes need to be somewhere.
And
Yeah. So,
and I
sorry.
agree.
Yeah, I think maybe it's being misinterpreted. So Amy's saying exactly that. It needs to remain factual, right? Right, Amy. I'm not missing the mark there. That we want to include these notes 100%. And by the way, I'm totally fine with the owner reading that they declined. I mean, that's what they did.
Yes, absolutely. And that's exactly what I'm saying. It in practice, if you offer a client a dental and they decline that dental, you record that in the record. And if they tell you that it's a financial concern, you may record that as well, because that's factual. And so, offering a client a consultation and having them decline, it is fine. But saying that the client was rude, aggressive, combative, those things are not fine. And so, because that's our own personal perception.
So if they were verbally abusive, we can't write that down.
So you need to be factual on the information.
Because Like if they're swearing at me, I'm not gonna write down what they said swearing wise, right?
So
That's not.
you can yes say client used explicits. Thank you, Sarah. So client used explicits. Client raised their voice. The client um, seemed angry.
Okay.
Okay. But because clients can rebuttal to those things and say, I wasn't angry, right?
Yeah.
Or, you can, if a client swears at you and you say client used explicits, then, and they say that they didn't, then that's a problem. We're not changing our stand at all on, that client that we have a zero tolerance when it comes to, clients shouting and swearing and being difficult, and that you can discontinue those calls and all of the things that we've talked about in the past in our meetings.
Sorry, can I interject there? Is that okay?
Yes, please.
Sorry if I have some background noise here. I'm on a soccer field. Um, so I think there's a medical record piece, guys, and then there's also the other piece where if there's an interaction that's very negative, we encourage you to write out your experience in whatever wording you want to in case it escalates on our side or on the client side. So write that out in a report in your own words and hand that over to us in terms of what happened. And that won't go into the medical record, but we'll keep a record of that. And I think there's value in that, and that could be whatever language you want to use.
Thanks, Sharon.
Email
Yes.
that to you guys, or like, because where do we write that?
You would just email that to us, and many of you've already done that, where you've sort of sent us a synopsis of what something that's occurred that's concerned you.
Okay, thank you.
Yeah.
Thanks, Jenny. Any other questions?
So just wanted to remind everybody about our friends at PetSmart. I did actually have a meeting with Sharon, Krista, Jared, and Brandon from PetSmart, and great feedback still. So great job to our whole team, the DVMs as well. Of course, I know they're not here, but PetSmart staff are very happy with the service that we're providing. So keep up the great work, guys. I know it can be kind of a little back and forth sometimes, but you guys are really nailing it, so keep up the great work. I just wanted to kind of remind you of a couple things. Consultations for owned animals must remain mid priority for now. We're just noticing that obviously with the summer, consult volumes getting higher, and these patients have to be seen quickly because remember, there's a pet owner potentially on their way to come get them. So we obviously want to provide care as quickly as possible. However, if you're on with a veterinarian who's available, absolutely, you can assign the consult to them. Tell PetSmart they'll be 10 minutes or however long they'll be. Make sure you're getting photos, all that good stuff. Okay. Mentioned this a while back, but for hotel cases, if we can continue to email a copy of the medical record to their email, in the PetSmart SOP, there are all the emails for the hotels. There's not that many hotels. Just because their consults are booked under the main store account, that was just making things easier so that everybody could have the same kind of file. So if we can continue to do that, that would be great. Exotic cases can be booked as low or regular priority for our shift DVMs if we have an exotics savvy DVM, of course, right? And I would like to give big shout out to Amy for doing her darndest to have at least somebody around for exotics lately. I will say that things are definitely better than when I first started, when sometimes we take a couple days to find somebody for exotics, not PetSmart, obviously. But Amy has worked really, really hard on getting coverage for those. So we've got some solid exotics vets. So shout out to Amy. And just something I want to mention to you guys, it's more for the DVMs, of course, because as RVTs, we're obviously not doing these consults. But just so you guys are aware, PetSmart has specific protocols, just like any company, but their staff are not able to apply topical medications or bandages to owned animals. And any animals that are in their care, they're not able to apply e-collar. There might be an exception for pets in an extended stay within a hotel, but this will be a discussion between the DVM and the PetSmart staff. And Sharon, I was gonna say I hear you on wind, so you can go ahead and jump in.
I'm sorry.
No,
Yeah,
it's
it's
okay.
windy. Okay. Yeah, I want to just clarify there. So they're not able to apply topical medications or bandages. I mean, bandages in general are not a good idea when somebody's untrained, but topical medications and wound cleaning is the other one that comes up a lot. They're not able to do that for pets in the doggy daycare or pets in the grooming salon. So we'll amend this wording and resend this to you guys. But for pets who are just in there for daycare, think of it like that. If there's an owner coming back today for this animal, then the owner is expected to do the wound cleaning and topical medication at home. If the owner is not coming back today for the animal, so if it's in a pet hotel, I think it was fairly clear to me today anyway that it is permissible for the PetSmart staff to do some wound cleaning, basic wound cleaning, and topical medication application on hotel pets. No bandaging. Bandaging is just not going to be safe, and no e-collars. But they can do some wound cleaning and topical medication, and the same applies for PetSmart owned animals, so our exotics. That would be permissible for them as well. So just think of it as the ones that are just in for the day. The safest thing is to, they're okay to wait for a few hours for that to happen.
Thanks for that, Sharon. I think the DVM SOP goes into more detail, but I will confirm that that bit of delineation you said is definitely available for both SOPs.
Great, thanks. The thinking there is that once they're admitted to the hotel, or certainly if they're PetSmart owned, that the PetSmart employee is acting as the agent of the owner. So it's permissible in that case.
For sure. Totally makes sense. All right.
Question about the PetSmart cases. I know that PetSmart kind of headquarters or whatever has their own like kind of criteria that they have to have the pets assessed if they see any of these things. Is there any wiggle room in having some of that revisited? Because I feel like a lot of the PetSmart cases are taking priority over some of our other like client-owned cases that are not urgent at all. Like non-bleeding warts and stuff like that, and are some of our pets that are, vomiting diarrhea, like need to be seen, are waiting a little bit longer because that like a non-bleeding wart is being seen, and I find it especially on weekends. So I just wondered if there was some wiggle room with like PetSmart, the people to be at PetSmart, of revisiting some of that criteria for what needs to actually be seen.
So sorry, are you referring to the critical signs of stress?
Well, no, we'll have a like a PetSmart case booked. I can remember one, for example, it was like a little skin tag, and they thought they nicked it, but it wasn't actually bleeding, and it because PetSmart takes priority. It got priority over like another case that was like a dog that was vomiting and diarrhea, and had already waited a couple of hours, and now this PetSmart all PetSmart cases trump other cases. So
okay, yeah, sorry, I thought you were talking about. I thought you mentioned their internal criteria, because they do have their own signs of stress criteria that they use, and if an animal falls under that, then they're supposed to go.
I think she just lost her connection.
Yeah, I think so. Yeah, I just find that like some of the cases that we're seeing through PetSmart are like, yes, they take the vet like just maybe a few minutes to see the case, but then it's like records and notes and all of that stuff. And our cases that do need to be seen are waiting even longer because of them.
So,
Right.
can I just ask a point of clarity, maybe? So, in that
sure.
situation, the PetSmart case went into them. The other case, where was it sitting as a priority?
But even if there is a mid, the PetSmart case still bumps it.
If there is a mid, so if you have a high priority, that always gets priority.
Yeah, but if it's a mid priority that's waited, we've quoted 1 to 2 hours. A PetSmart case came in, and now that mid priority is now over their 2-hour mark, because we've had to bump on the weekends. We'll see multiple PetSmart cases back to back, so they'll just keep coming in, and so it does happen where
So then all the other mids get bumped.
because of a PetSmart case.
Yeah.
Yeah,
I'd say so. It's just about managing our case are cases that are in queue, and so for that case that's been waiting and needs to be seen sooner, I would just bump that to high, and that'll trump. The medium cases.
But what about like on the weekend? You know, we like there's the other night we had multiple in mid. We can't bump them all to high.
No, but if I mean, we have multiple in mid, but how many of those are where are there where 15 or 20 minutes makes a big difference? Do you know what I'm saying? Like, I think a skin tag, you use the example of a skin tag, that can be dealt with in 5, 10, 15 minutes max.
But it's not. It's being dealt with in like half an hour, 45
Like, it's
minutes.
taking, you mean it's taking a half an hour for the doctor to deal with that?
Sometimes, yeah.
Also, because including notes and everything as well. And also,
Yeah.
if the other client-owned pets have been waiting in mid for a couple of hours, and then all of a sudden PetSmart cases come in, then all those client-owned cases get bumped
Yeah,
again.
and I think
Fundamentally, though, if I can interject there, fundamentally, it's your job to decide, right? If we have more critical, like a critical case where it's like, this is going to be a big difference to this pet, this half an hour, 45 minutes, whatever you want to call it, then put that patient into high for sure. Or if they can't get to physical care and that's what was recommended or whatever, put them into high. If it's a case like an ear infection, I understand an ear infection might be more pressing than a skin tag, but those types of things, in that case, we have to manage the client expectation because it's not.
Oh, yeah, and I understand those things, but it usually the cases are already in mid. We would never put an ear infection in mid. It's usually cases that are in mid priority already, and it's in my experience, we don't often get a lot of assistance from the network on weekends. So it's our shift vets that are trying to manage, 10 to 15 consults with maybe 2 or 3 of them being PetSmart that just get bumped. And they bump and they bump and they bump.
So
And also, it
can
feels
I
like
ask
we're
a- can I ask a
prioritizing
So I was
question?
just wondering, is it something that like we can have a conversation with PetSmart and say, hey, I understand your concern with the skin tag, but if it's not, actively bleeding, maybe it's something that doesn't need to be booked.
I can I just ask a
No.
clarifying question for Sharon and Amy? Can you guys hear me? Okay.
Yeah.
Are we like what are our vets instructed to do right now? Maybe I'm just misremembering, but is it always that if there's multiple mediums in the queue, it's not based on time in the queue, it's based on if they're PetSmart or not? Like what is the instruction to the DVMs?
You're asking this of us, sorry?
Yeah, Sharon and Amy, what's the instruction to the DVMs?
If there's multiple patients in queue, the DVMs are to select. Now, of course, I'm talking about staff DVMs are to go
Yeah.
in order of priority. Network can take whatever they want to take that they can visualize.
Yeah, but your shift DVMs, they're taking based on priority. I'm because there was a comment that was made that like PetSmart trumps everything in medium. I guess I'm questioning, is that
I question
is
that
that
as
true?
well. Yeah, no,
Yeah,
I
yeah.
question that as
I
well.
don't know that that's the instruction that we've made. So if you have a particular vet who's taking that approach, I feel like that's a like we've never said that PetSmart mediums take over priority on all. I don't think we have, and I guess maybe that's why I'm
No,
asking clarification.
we haven't. If there's something that's critical, a patient's in pain, or there's something going on that's concerning to the DVM on shift, they're meant to take that first. I'm going to be frank and honest with you guys. Without PetSmart, we cease to exist. They are a very important client for us. And so we do have to provide care for those animals. And we do have to do that expeditiously. There's no question. And so there's some wiggle room there that we don't put them in high priority because we don't want them to trump everything, as Mike just indicated. But we've made an agreement with them that we'll put them in mid. So that's the arrangement that we have. We want to continue to be able to provide care for pets throughout Ontario, BC, Alberta soon. And so this is a way that we're able to continue to function. And it's sort of a little bit of the price that we have to pay. And I just want to be upfront about that.
I think it's probably fair to say that we can communicate to our vets that it's based on time in queue and concern, not whether or not they came from PetSmart, right? I think maybe that's a misinterpretation from our vet staff. I'm just wondering if that's what's happening here.
Yeah, in my experience, the only thing that would trump would be a high priority. Otherwise, I do see if it's a PetSmart case, it gets taken over mid priorities.
It's supposed to depend on what the mid priorities are. Like they're supposed to be putting in sort of a ranking as they always have. So that's how it's supposed to be, and to a large extent, we need to defer to their judgment on any given day. I mean, we can't start to get too prescriptive about that because each DVM is going to have their own way of looking at it. But we have never instructed the DVMs to take PetSmart cases over everything else mid priority. They're supposed to look at them and make a judgment call. To answer your question about whether this can be a conversation with PetSmart, when it comes to the grooming salon, it really can't be. We do the best we can for them. Sometimes we delay those PetSmart cases. We've had multiple instances where there's been issues because the owners have arrived before we've gotten to the case. And that just is what it is. And we've explained that to PetSmart that there were other patients that had to go before, and they've been understanding about that. So there has been give and take here on both sides. So they aren't getting everything that they want. They wanted them in high priority, and we said no.
Can I comments in the queue? I'm writing some responses, but Jenny had mentioned that with the grooming patients with PetSmart, they were to be a priority within 10 minutes as the owners may be coming to pick up. So that's in regards to our staff or our core DVMs. If the core DVM can take the consultation within 10 minutes, it's fine to leave it and assign it to them. Otherwise, they should go out to the network. Obviously, we can't guarantee or control how quickly the network's going to take it, but they are mid priority as discussed. Lori, would it make sense to have vets on the weekend scheduled to prioritize PetSmart and one to or prioritize Smart Vet and then one to focus on client mids? I think you meant PetSmart and then client mids. I am looking at adding another shift through the summer for exotics on the weekends, which will add extra people. And you will see that some weekends in June that has occurred. And actually today I asked Mike for some data so that I could assess the number of cases that we're seeing currently. I did want to respond, Cheryl, that there seems to be a lack of network engagement on the weekends. And so that's very important for me to know as well, so that I can, start to engage the network a little bit more. So all of those things are in, are important in um, playing a factor in how quickly these cases are seen and the management of the queue. And so any feedback like that is really important for Sharon and I to hear about for sure in regards to the doctors. And we'll chat with the DVM team as well to see if there's anything with these cases that are bogging them down where we think that they should be quick cases, but they seem to be taking a little bit longer and with their efficiencies as well. That unfortunately for those grooming salon uh, clients, they do need to complete their records immediately because the client is coming to pick up and the store needs to send those home. So I think I think that could be part of it. I agree, Rebecca, that having the leads organizing the DVMs, and I know the DVMs are absolutely loving that. And so they love that you guys are taking the guesswork out of it for them and just telling them what case to go in.
I do agree with that. I think that is very helpful. I think ultimately, though, it is going to be the DVM's discretion. And if there's something else that they think is that they feel is more pressing, then that's their prerogative to choose that. But I think it's super helpful to give them a little synopsis of the ones that are concerning you the most, especially for those people who spoke with the clients directly.
All right. If nobody has any more questions or comments, we can talk about some portal updates. So those of you that have been on shift in the last couple days might have noticed that the on-call events look maybe a little bit different. Maybe you didn't notice. That's okay if you didn't notice either. But the actual event is much larger now. Look at it. It's so beautiful. It doesn't all fit because some clinics just have so much information. So you do have to scroll sometimes, but it's nice and big now. And the other thing, the backup number for the clinic on call is now in the on call event. Hooray! So if you cannot get a hold of whoever is on call, you have a backup number that is much easier to find. Obviously, again, this is Shannondale and Shannondale here on this side. This was Calendar on this side. So always, like always, if I've harped on it in training, we're not going to bother this person backup number, but now it makes it so much easier for you guys to find. It's right here. And I don't think there are too many clinics that don't have one. I might touch base with Amanda on that. I don't think that's the case anymore. I remember for a while there weren't there weren't people that had them. So yes, this has been a great update. Another small update that I'm happy about is now the address for our hospitals is at the top of the hospital info card, so you don't have to scroll all the way down. So super helpful when you're trying to confirm where these clinics are, especially Cough, Sault Ste. Marie. Although I did put in brackets what street they're on, but obviously that's super helpful too. And as Jared and Mike work through feature updates, I'll try to just either share them in the meetings if they're around this meeting time, or at least send you guys messages if they're important and helpful to you guys to know. So lots of stuff coming through. And as Jared said, we'll have a way for you guys to send feature requests. And we're going to have the best portal ever by the end of this, whenever this ends, whenever we're finished. It'll be good. All right, Mike, this is either you or me or both of us, or however you want to go, if you're still here. Maybe not. Well, I've had
Sorry, Sarah. I think he lost reception there.
it's gone. Okay. I had a couple RBTs just kind of ask, like, the percentages, like how, when do we, when does management or admin get concerned about percentages and numbers? And as I've told any of you in training, you're going to have shifts where you'll take 5 calls in a row and they'll all be direct transfers. You can have a porcupine quill, block cat, a saddle thrombus, a GDV, and a euthanasia. It happens. It's happened to me multiple times. So we don't worry about transfer percentages unless we have to worry about transfer percentages. And when I say that, what I mean is the majority of your calls will be cases that do not require immediate transfer. That's just the law of averages. That little script that we have in the portal when you're booking an appointment says up to 70% of cases, or 70% of cases don't need in person, something along those lines. It's true. Those are analytics. That's just not some fancy number that we pulled out. So the fact of the matter is most of your calls don't need to be transferred right away. Are you going to have calls that need to be transferred right away? Absolutely. The time we get concerned is if your transfer percentage is higher than your booking percentage, or your booking percentage is extremely low and you've got nothing but transfers. There's something not quite adding up there because statistically that doesn't make any sense. So if you have a transfer and it fits the criteria, a case where it fits the criteria, then you do the transfer. If it doesn't fit the criteria, and a transfer happens after, it's still, again, I've said this a few times, it doesn't mean that you've made a wrong call. Sometimes it's just the veterinarian has to look at this animal too and to get the full picture. So obviously, if we start seeing that your transfer percentage is much higher than your booking, or the ratio isn't quite looking correct, ongoing, maybe some additional coaching is needed. Maybe we just need to talk about how to be able to explain telemedicine and be able to explain the benefits of it, and those kinds of things. Mike, I think I saw you come back in now. Are you with us?
Hey Sarah, I am, but I'm in the car right now, and I'm in and out of options. So
Okay.
go for it. If there's anything I want to add, I'll add it through text.
Okay, sounds good. All right, so I did send a message out today about managing air call status and efficiency. Okay, so what we've done is we've implemented kind of a protocol for managing your status and air call. So if you're available, that means you can take calls. I mean, that's pretty self-explanatory. And again, we go through this in training. If you're ready to take a call, you're going to be available. If you go unavailable, we want you to choose a specific quote unquote status. Okay. And this will kind of help us see what everybody's doing. And it just gives a more accurate picture of what everybody's working on, right? Because sometimes you're trying to get a hold of somebody, like even in Spot, and they're not answering. Well, maybe they're doing a transfer, maybe they're doing a direct transfer, maybe they're doing a task, etc. So I've put on here, there is an SOP on it as well. I posted that into Slack. We'd like you to choose these 4 statuses depending on what you're doing. So if you are on your 30-minute break or stepping away from your desk, right? Please choose the on a break. Okay. The out for lunch, I don't know, I hate that there's 2, but we chose on a break because that just made sense. In training is going to be used if you're in training, makes sense. Or if you're walking a client onto video after booking an appointment, performing troubleshooting while on video. Those really are kind of the main things. Okay. Back office, you're going to use this when you're completing any task, transfers, prescription, follow-up, general tasks, etc. If you need to be unavailable in air call while you're working on that, you're going to choose back office. And then other is only going to be for RVTs, of course, when you're completing a direct transfer. So if you're finishing the paperwork, if you're texting on call because you hung up with the client, anything like that, you're going to use other. Okay. So this is just going to help us kind of look at efficiencies and how much time is being taken for these kinds of each type of task or call. And maybe we can look at ways of, fixing the flow in the portal. Maybe the portal is holding things up. Maybe there's one other step that we could change or those kinds of things. Maybe there's a protocol with a certain hospital that's causing a little bit of a slowdown. So just kind of using it to kind of make things as efficient as possible and, get you guys through your calls as quickly as you can so you can get through your day and not feel like you're, dragging through all these long cases and those kinds of things. So just to kind of help us figure out who's doing what and how long it's taken, that kind of thing. And that's perfect, Mike. It also helps the team leads understand what the team is up to. So they're not like, hey, what are you doing? Why are you unavailable? Right? Because we have no idea. We're not all working together. But this way, if they see that you're finishing, you know, walking somebody to video, they can, say, hey, could you do this when you're done that? Because I can see what you're doing, those kinds of things. Shauna, when it's a lead position, putting out fires, I would just use regular unavailable. I think that's fine, Shauna. If Mike disagrees, he can message or comment.
I agree. That's great. Yeah, that makes sense.
So Lisa, you're just going to choose back office when you're doing tasks and other when you're doing a transfer through the portal, and that's it.
Like
And
a direct transfer. So what that means is like you don't have enough time in after call work, right? Your after call work gives you your 3 minutes, but then you're like, oh shoot, I need to finish this up still. You just go over to other.
yeah,
That makes sense. And answer task for, or sorry, one status for tasks. So hopefully that helps because it's just back office.
exactly.
Yeah.
For new hires who need a little bit more time, I'm going to say, because you're probably going to be doing transfers, I would just do other. I think other's fine.
Yeah. Yeah, exactly. I'd base it off of.
Mandy, we can't change the names of any of them, or we would have. Yeah, unfortunately, we asked Aircall, and yeah, there's no way for us to rename them. So you guys just have to work with what we've got, unfortunately. Okay.
Sorry, Lisa, you said that's still confusing to you. You mentioned in the chat. Just want to let's get it clarified now, because if you're stuck, there's probably others who are too.
So Lisa, if you are working on a prescription, a transfer task, or a general task, and you need to go unavailable, you're just going to choose back office. If you are doing a direct transfer through the RVT portal where you didn't book an appointment, you're just, you're doing a transfer, you're going to go to other if you need to go unavailable. That's all. That's the only difference. Like I said, it's just to also help our team leads out so they know that who's doing what. Okay. Everybody good? There is an SOP to remind you too, so you don't have to memorize it. Large animal, I would do other. I can add that to the list for large animal, or for other, I can put large animal. Yeah, exactly. If you can get it done in 3 to 5 minutes, you don't have to go and change your status. Like nothing that hasn't changed. It's just for those times where you need to be unavailable after a call.
Yeah, this will also help. Like then we understand too, like if things are taking longer than after call work time, right? And then we need to adjust after call work time potentially. Like that, that's gonna help too. Sarah, do you mind taking this question from Melissa? I wanna-
I didn't hear any of that. I heard Melissa. What?
I think we're just talking about Melissa's comment in the chat, maybe.
I think that's what he meant to say.
Yeah, there's a comment, and she says, "I find the long calls happen. What does everyone do when we have a direct transfer, and the on-call wants a text, and then waits 20 minutes for them to message back before you call them? It's so long."
So I would do something else that's not going to take up a lot of time. Go back to the client, update them, ask if you can call them back, depending on the status of the animal. Um, and I mean, those are kind of the things that I do.
It is hard. I try to do like consult reviews and stuff, but I find if I got onto another call or take another call, I find I'll get lost in what I'm doing sometimes. But I definitely try to keep busy and stuff. But is there any way we can like? I know the 20 minutes is there sometimes just with like sending out whether the cell range is good in certain areas and stuff like that as well too. But 20 minutes when you're trying to do a direct transfer is so long.
So I don't stay on hold, like I don't stay on the call that long. If after a few minutes I don't hear back, I'll just tell the client, "Hey, look, I've contacted them. Let me follow up with you once I hear back. I'll send you a call. I'll call you. I'll send you a text or something like that." And then I would just work on something else. The thing is that you can take another call, right? If you're going to be sitting there waiting for 20 minutes, sometimes you could take another call in that 20 minutes that you're waiting. So that's what I usually do.
Also, and if you are on another call, don't feel badly, especially if it's a non-urgent call, about telling the client, I just have an emergency I was attending to just before you, and I just have to respond quickly, so you don't just go AWOL on them or that you don't leave it. But clients are super understanding. I mean, I can't speak from the RVT side, but my experience when I've been in a consultation and I've had to go circle back to another consultation where I was waiting for, say, the animal to vomit or something, I haven't had any clients be upset with me about jumping between consults. I'm just honest with them.
Mhm. Yeah, and Kristen actually made a good point too. You can also tell ask the owner to call back if they don't hear anything in 30 minutes. And I've texted an on call and said to the owner, "Hey, I'll call you back," and then I'll maybe do my follow up call, and they're like, "Oh, I already called them," but they just didn't bother to reply. So sometimes they're busy and they just didn't text back. So that also happens too. So
And I want to be clear about, why are we measuring these types of things? Because I'm obviously used to physical practice where we're a lot less granular about understanding the processes and the flow and all of that stuff. This is super important information for us to have, and it's not that anyone's trying to, manage the heck out of you guys or understand what you're doing with every moment of your day exactly, or that it's any sort of like supervisional type of thing. It's really so we can understand, when we're staffing, for example, are we, as Mike said, do we need to adjust expectations for times? Are there things we can do in the technology to streamline certain aspects of what we're doing? We need to understand where our resources are going to and how to better allocate timing, et cetera, and staff management, so that we can make everybody's workflow easier. So these are important things for us. I don't think we recognized at the beginning how important gathering this type of information was going to be. In physical practice, we understand benchmarks. We have so many physical practices to look at and to understand, where should we be and how should this be flowing, to have a really effective, high quality practice. But in telemedicine practice, we just don't have any of that data. Like, we're relying on ourselves here. To figure this out. So it's really, really new. And so all of this information becomes really valuable for us.
So we don't have a ton of time left, but I did kind of want to see if we could have like a little brief powwow discussion of strategies for explaining the benefits of telemedicine. I know we have some newer RVTs, and I always get feedback that how do you talk to people and explain to them that telemedicine is the right choice, and we're not a barrier to them seeing their vet or talking to their vet. That we're a good first line, those kinds of things. So I just thought I'd kind of open up the chat and if anybody wants to kind of chime in on some of the wording you use, or some of the things that you tell clients, the reasons why telemedicine's a good choice and why it's helpful to start with telemedicine. And by all means, Sharon, Mike, Amy, feel free to jump in with anything. But we can start getting people typing in the chat.
I have a few. Sorry, Sharon, were you going to say something?
No, I want you guys to go. Go ahead. Go ahead.
A couple recently. Some of them are easy ones where the client, okay, perfect. Then we should start with telemed. We can save you guys typically money because you may not have to go into in person. And then the second one is it's lowering them in your home. The doctor can do an assessment and see your pet in a in their.
I think we're losing you. You keep cutting in and out.
Can you hear me now?
That's better. Or not.
I'll just type it.
Okay, because you had some good. What I heard sounded good. So, well. Okay, so telemedicine allows us to help with urgent cases, keeping non emergencies out of the vet's office so they're able to help with true emergencies. Sometimes it's less stressful for the pet to do virtual. It can be less stressful situation for the pet. On balance, you will save money do using telemedicine versus going in person every time, since over 70% of cases can be managed virtually, at least initially. And that's a really good point, too. And just want to always put the plug in. Please, please, please always make sure that the client knows that telemedicine is not the end, it's not a dead end. Um, Obviously, if they need care after, we will arrange that for them 100%. So please always make sure that you're making clients aware of that. Okay. Telemedicine is a great way to help establish how urgently your pet needs to be seen. If we have to transfer, the in person doctor will have more information. That's a really great point, Lori. You don't even have to leave your house. Some people really like that. We often can see your pet quicker and start treatment versus an extensive wait in emergency clinic. Excellent.
Sarah, I have a question. The problem I run into is when I do say we can start with telemedicine, or if they need a transfer, we can definitely arrange one. When they say, well, then I have to pay twice, I never really know what to say to that.
That's where my comment, and I sound like a broken record with this one, I'm sorry, but for the people who are new to us, it's worth repeating. My comment about on balance, you'll save by using telemedicine every time. So if you want to go to the ER, or you want to go to on-call 4 times, you're likely to only need, statistically, to go to physical care 1 out of those 4 times. So 1 out of those 4 times, you're going to pay twice. You're going to pay for telemedicine, you're going to pay for physical care. 3 out of those 4 times, on balance, again, unless you're unlucky, you're going to be able to get away with telemedicine tonight and maybe go see your regular vet tomorrow or the next day. So you're going to save money on balance, if assuming that you use us every time. So that's how I explain it to people. Yeah, there's a small chance that you might have to pay twice, and that may happen today. But the next 2-3 times you call, very likely that won't be necessary, statistically.
Okay, thank you.
There's a couple other here. It's common these days for emerge clinics to have a 6 to 12 hour wait versus, say, our 2 hours. Telemedicine may help get your pet medication from a local human pharmacy instead of having to wait for your vet clinic open. Even if you're transferred, at least you have peace of mind knowing you needed to head to emerge. I think that's a really good point too. Lots of time and money that you may have otherwise been thinking you could have avoided. Our veterinarian will do an evaluation with your pet through a video call so they can better understand what's happening and best support them going forward. Depending on the presenting complaint, I may even say that we can help to manage the pet's comfort, start meds, whatever the situation, until follow up can be arranged. That's a good way to put it too. If the client will be waiting for emerge 6 to 12 hours, they may as well wait at home for the night and be seen. Might as well stay at home and be seen at home, and if needed, head into in person in the morning. That's very true too. Yep, exactly. Combined with Cheryl's, that's a perfect sandwich of a good way to explain it. I often say that going through telemed first will give us more weight if we do need to appeal to on call. That actually rings true, guys. Trying to transfer something that maybe it doesn't quite fit the criteria in like Sudbury, But after our doctor sees them and has seen the animal and knows they need to be transferred, um, can make a world of difference for sure. Yeah. And there's always going to be some client education too. That's a really good point, Jenny. I mean, obviously, I know this isn't a wellness appointment, but there's always a little bit of education from our veterinarians, which I think is great. And Mandy, yes, I'm going to collect all these and put them in a document in the Talk Tracks channel, just like I did the last time. So they'll be there. Yeah, some good stuff here.
These are great responses, guys. Thank you for that.
Yeah, it's a good point too, Sean. A lot of the time, there is always a reason to recommend telemedicine. Sometimes owners just even need education. You know, again, it's not a wellness appointment. Like, I know we're not like in practice just doing like annual checkups and stuff. But sometimes, I've seen our vets records where they do talk about food and like a balanced diet. Maybe they're just feeding raw, and so there's a little bit of a discussion about you know um, vitamin deficiencies and those kinds of things. So there's value in telemedicine for sure. It's just making the client comfortable with that decision and your confidence in why you're making that or recommending that avenue for them for sure. Definitely cats, 100%. We've been seeing a lot of dogs lately actually that aren't good in clinic, just for things like skin and ears and stuff. And as somebody who's had many aggressive and fear aggressive dogs, it's definitely telemedicine is the way to go for sure. So yeah. But yeah, this is great, guys. I won't have it today, clearly, but I will have these all together for you, and I'll attach it to the message I sent out to you guys after the meeting, and I'll put this in a little document in the talk tracks. This is great.
I think Smart Vent. What happened to Smart Vent? I think did it go the way to the dodo?
Uh, we were gonna try it after this meeting, but we have a different meeting. So
Okay.
I think we're gonna maybe chat about it next week and see what we want
Because
to
we
do
didn't have
next.
great engagement, did we?
We did not know.
Yeah. If people want it, that's awesome.
Hmm.
I think it would be great to send a reminder because I kept meaning to show up. I kept forgetting. And when people reminded, then I was like, oh, yeah, I know to invest to show up. But then it's something maybe a reminder would be good for when to happen.
Can you just fill people in if there's anyone who's not familiar with what that is?
Yeah, we were trying to book I think we did 30 minutes once a week, or was it once a week? It was once a week, where two of us in admin would just hang out in a spot on the patio. And if anybody needed to chat through their week or talk about a rough case or just what's going on in your life, we were happy to do that. We didn't have any engagement, but sometimes I know that with me, I want to talk about it in the moment, and I don't want to be you know reliving it later. So I totally get that too. But yeah, so leave it with us. I'll chat with the rest of the team here, and we'll see what we can do. So yeah. And yeah, please reach out to Amy. She's lovely to talk to. She takes all my trauma. No, she's great though. But oh, speaking of Amy, we haven't done ballots yet. We had a lot to talk about today. Amy, you still around?
Sure am. Can you guys see my screen, which is now the ballots? Can you see it now? No?
Yes, I moved it over.
Okay, perfect. Okay. I mentioned to Sarah tonight that this is the most number of ballots that we've had in our history of doing ballots, I think. 54 ballots. Look at that wheel is jammed. Thank you, everyone, for all of your exceptional extra work this past month and your help. I'm going to shuffle it up. Lots of high numbers in ballot collection, too. So there's a few of you who really went above and beyond. Thanks for that. And our winner is Karen. I will reach out in regards to your prize, Karen.
Perfect. Congrats, Karen. And any final questions? I know, like I said, we're a little past time. Okay. If nobody has any questions, we can let everybody go.
Oh, wait. I have something really exciting. I just got a message from our fearless leader, Mike, who said with the high number of ballots that we can do 2 spins.
Oh, nice.
Well, isn't that amazing? Working for SmartVet's pretty awesome. Let me just go on back to the screen. So, Karen, I'm just going to remove your entry since you're already a winner. Just give me one quick second, guys. If I can find it there. Okay, I'm going to shuffle them up again. And the second winner. Amazing. And Dana S., you are our second winner. We'll also be in touch with you.
Am I wrong, or was she our highest number of ballots? I feel like she was the highest number this month.
I think she was the highest with 6.
Yes. Yeah. Dana's really she's been a busy lady helping us out, so and we appreciate all of you guys. We say it all the time, but I'm going to say it again. And grabbing shifts, SOSs, extending your shifts, just schedule stuff on behalf of Lindsay and myself because she had to duck out. We do really appreciate you guys, and yeah, keep up the great work. And thanks for coming out tonight.
Thanks, everybody.